Comments or questions? And we have mics. Who wants to make the first gift pledge today? Here we go. Yes, we have a question.
I have a question, which is,
Please use the mic if you can, so it will.
Can you hear me now?
Yes, we can.
So my question is, what happens to an adult man with a cardiac problem?
Adult man with a cardiac problem comes to this emergency department here on Parnassus and receives care here. And same with an adult woman with a cardiac problem would come to this emergency department and receive care here, or receive, in general, receive care.
But basically all adult men's health outside of cancer would be at this campus?
Yes.
What happens once Moffitt goes down?
Well, the ultimate, we have done initial planning on what could happen when Moffitt needs to go down, including a possible move, finding a new home for the Langley Porter Psychiatric Institute, perhaps at Mission Bay, perhaps at Mount Zion, perhaps on this campus, who knows, build something proper for that facility. And on that site, we could build a replacement for the Moffitt Hospital and tie it into Long Hospital. Long Hospital has many faults, but one of its assets is it was designed in such a way it's going to last forever. So we'll figure out how to leverage that.
Underneath the question is really kind of a point of view that says, as a daughter and a wife and a mother of adult sons, that often adult men don't pursue care when they need to. And it's a corollary issue to women's health issues in a certain way, that we neglect and overlook and fail to serve men sometimes because men don't reach out for health care preventatively when they need to. And so I'm wondering if there's a role for UCSF in men's health to create models that will allow men to receive health care appropriately.
Good.
Early.
Jan, you want to make a comment on that? As a man.
I think you're raising some good points, and I think what the opportunity and one of the points of saying that Mission Bay needs to fit into the larger context of what we're doing here at UCSF is that our focus, for obvious reasons, in the last couple of years has really been focused on this project. Let's get this project to the point that it is today, where we can move it beyond the tipping point and say this is going to happen. Having got there, it's now, I think, imperative that we make sure we put it into the right context. And we have a huge opportunity to think about what Parnassus campus is, where are the programs that are going to be the kind of anchor highlight programs of Parnassus. And I think what you're challenging us is, let's obviously focus on programs that we're great in, neuroscience, transplant, but maybe think in a different kind of context. And I think the Mount Zion opportunity is huge to really do something different and out of the box there, that just as we have a center of excellence for women's health, let's think about that. So I think one of the things that we'll be inviting many people in this room and people who couldn't make it here today is on the Mission Bay campus. I think our next big intellectual challenge is thinking about operations. We've got the physical facility essentially nailed down. And obviously there was a lot of thinking about operations that informed the physical design, but now we really got to get into the nitty-gritty to say this is an opportunity to think about how we run and operate a hospital, how people do their work in the physical facility in a different way. Let's not just take what we're doing here and take it down there. Let's really think out of the box. And then the second imperative that we have is, okay, there is this space going to become available on Parnassus. What's the most innovative, imaginative, effective way to use it? And Mount Zion is going to fundamentally change in how it can service the community. What is the most effective, imaginative way that we can do? And so a lot of thinking has to go into that, so that we just don't sort of by default expand our current thinking. And I think your idea is just one of I think many imaginative ones that will come to play. I actually thought your question was a little different, but it obviously wasn't, and that is an adult patient admitted for a prostatectomy may well develop chest pain, and what are we going to do there? And there's already been a lot of thinking about that. Some of our experiences at managing those issues at Mount Zion have been helpful. Technology, the fact that there is a cardiovascular research building that will have an active cardiac clinic in it, in the research campus down there, and there will be neuroscience and neurologists there. And so, again, that's one of the things that we need to continue to work on over the next couple of years before the building opens.
Other questions? Yes.
Your comment about the operations considerations it has been, I think, weighing on my mind a little bit, because as a clinician who became involved relatively late in the process, but was involved somewhat in the blueprint design, I think that the clinicians were heavily involved in that period. And then, you know, it's amazing how much work has gone on, but I feel like we've not been as involved, and now we're at a stage where the operational design is incredibly important, and not just for the Mission Bay campus, but for the other campuses. And so I'm wondering kind of what the timeline is, and Cindy and I were talking about this a little bit beforehand, but for re-engaging the clinicians. One example is our mission of advancing health worldwide. What are the operational considerations and therefore the design considerations for things like telemedicine, and not traditional telemedicine, but really, what's going to be innovative and available given the high-tech environment that we have.
Anybody want to? Go ahead.
Yes, and as I shared with Dr. Sun before the meeting, the goal is to get the operations group up and running right after the first of the year. We have several tracks already going. You mentioned telemedicine, and there is an IT executive group that has been meeting once a month and has several subgroups going, and telemedicine is one of the areas that they have continued to explore. Seth Boxer from Pediatrics is active in that participation. So we will be getting work groups launched in early 2010. It's not too late if we need to adjust some things, and as you know, several people were involved over that long period of designing and planning, and operational considerations were made consistently during the detailed design process. But it will continue. This has been a bit of a heads down technical period where we've gotten the ICDC up and running and had to keep on a very intensive course to make the schedule, but everybody has still been involved in giving feedback.
I just add one other thing to this, that we started with a programmatic concept and worked out at not at a detail level, but a reasonably thoughtful level, operationally, the integration of the children's, the women's specialty, the cancer, how that would work together, how it would work from a design standpoint. And while all that work's been going on, then what Sam and I and several others have been particularly involved in is making sure that this project can happen. So while there's been work at the ICDC, Sam and I are out at parties every night trying to raise money. And in fact, work. Oh yeah, it's work. Believe me, it is work. But we are, as we've both indicated, we're very, very optimistic that is paying off, and that we are going to do. Now that this is going to happen, we now need to slip back into a much more intensive focus on operations and how to make sure it meets our needs. And of course, the fact of the matter is, we haven't even we've designed spaces, but we've not specified equipment, because we know equipment will likely change over even this period of 3 or 4 years in front of us. Please.
Thank you very much. This must be a very exciting time, and we look forward to seeing the final product. I wonder if you could comment on the outpatient office building and how much work is being done there and what it's going to be like. It seems like there's a lot of focus on the hospitals, as it should be, but obviously the outpatient space is very important as well.
Yes, I apologize. I had to get my slides condensed, and so only showed you hospital images, but I actually have them with me, and after this meeting I can show you some of the outpatient images. It is equally nice and equally far along in the design. In fact, we are considering building a mock-up of an exam room to be sure that we get the operational and functional issues worked out as well. But we are on the same schedule with the outpatient building, and it is being designed by the same team. And did you want to talk about that?
Yeah. So because of code issues in terms of building these spaces, it doesn't make financial sense to build conventional offices, meaning spaces for faculty or staff that are not seeing patients, but where you clearly need a space to do either academic work or administrative work. It doesn't make financial sense because of code issues to put them in the same building. So, but we're obviously completely aware that we need those spaces geographically linked to the new hospital. So we've done a lot of planning. We know the scope of what we need, and we have several different options as to precisely where geographically that is. Clearly, it needs to be the closer the better, and at a minimum, a very short walk, but not a drive. And we have a number of options there, either on private land or land that the university owns. We have options of the university builds the building. We have options of working with a developer to build a building. And we have, big, typical UCSF vision in terms of what it could be, and then a reality test on what it can we afford, and perhaps a phased approach to go from what we can afford to what we would ultimately like. So all of that is active. The good news about an office building is that it takes a lot less time to both design and physically build than the hospital project. We don't have a lot of time before we need to come down to some final decisions about site and exactly how we're going to build it. But it's completely on our radar screen that it needs to be part of this project and contemporaneous with this project.
Any other questions? Yes, one more.
Since there's no other questions, we have a couple of minutes. Has there been any consideration, I should say, I'm sure there has been, but if you could comment on the environmental impact in building an environmentally friendly building, use your solar power and so forth?
Where are you going?
You've got good things to say.
I do have good things to say about that, and it was one of those things I had to leave out of my presentation. We are very excited about what we're doing around sustainability. First of all, we're targeting a LEED Gold certification, very ambitious for a hospital. One of the key aspects of that is targeting using 50% less energy than the average U.S. hospital. I mentioned we have 60,000 square feet of rooftop gardens. We also have another 100,000 on the ground plane, highly landscaped, very welcoming environment, including innovative strategies such as taking the blowdown water from the cooling towers, treating it, and using that for irrigation on the site. So we're expecting, yeah, I did mention that. Oh, yeah. You'll notice in the images we also have photovoltaic panels on the rooftops, but we're also now exploring with a partner potentially putting those across the parking lot as well. So this will be a world leader in terms of sustainability in the hospital industry, all the way down to the materials that are being screened for toxicity that will be throughout the facility, fabrics, paints, and so on. So we have a lot of information on our website. I have put the URL up there on the screen, and there are several fact sheets, there are more videos, there's a lot about sustainability and lots of the exciting things we're doing, and please don't hesitate to take a look at that or give any of those of us who are listed as contacts a call, and we'd be happy to tell you more about it. So with that, thank you very much.
Any other comments? Great. Last one.
Will this presentation be posted somewhere? I understand it's being taped.
This entire presentation will be posted on our Mission Bay website at that URL right there. And probably won't be today, but it'll be up soon.
Thank you, everyone.
Thank you.